Hello, my geniuses. Welcome to another physio lecture series today. It's a great science tutor Lorenzo, and we'll be talking about cerebral circulation. And if you have watched my last video on the regulation of arterial blood pressure, so the next place you go is here, because here we'll be talking about regional circulation. And in regional circulation, you have the cerebral circulation, you have the coronary circulation, you have the fetal circulation, you have the splanchnic circulation, you have the capillary circulation. There's a lot of circulation in regional circulation, and that's what we'll be doing. But we'll just pick the most important one for you, which is the coronary circulation, which is the cerebral circulation, the fetal circulation. These are the major ones. Why capillary and splanchnic circulation comes out in different conversations in all our texts. So if you are just new to my channel, make sure to subscribe and turn on your post notification button, so that every time I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you solely. So let us jump right into the video. So you hear the word cerebral circulation. Cerebral circulation. Cerebral, which means the brain. Circulation is the movement of blood. Cerebral circulation. So what is cerebral circulation? Cerebral circulation is the movement of blood between the heart and the cerebral blood vessel to supply the brain. Again, the movement of blood between the heart and the brain is cerebral circulation. So the vessels that carry it is what we call cerebral vessels. So cerebral vessels carry blood from the heart, I get it now, to the what? To the brain. You get it now? Because the brain is the most fragile tissue that needs blood. It needs blood, and it needs the oxygen component of blood, because when it doesn't see blood, what happens? It starts damaging, it starts scattering. And remember that each part of the brain recognize some specific function of the body. So if one part is damaged, everywhere is gone. So the correlation and the circulation between the heart and the brain to the cerebral blood vessel is cerebral circulation. Now, if you want to understand, the heart pumps blood to the brain to what we call it the cerebral vessel. But now, which part of the cerebral vessel? So if you check about the cycle of the Willis, remember the cycle of the Willis, which you are looking at now. The cycle of the Willis. The cycle of the Willis is a polygonal cycle, which blood starts to supply the brain. Are you getting that? It's just a cycle. But now the cycle of the Willis is made up of two basic vessels. So you have the vertebral arteries and you have the internal carotid arteries. The vertebral arteries and the internal carotid arteries. So now the vertebral arteries you are seeing are branches of what we call the vertebral arteries. You are saying is a branch of the subclavian artery, while the internal carotid artery is a branch of the common carotid artery. So now go watch my video on cycle of the Willis. It's there in my neuroanatomy playlist, so watch it, and when you understand it, you will know what I'm talking about. But in the cycle of the Willis, the vertebral artery is the first part. The vertebral artery is gotten from the first part of the subclavian artery. So when the vertebral artery comes, what happens? It passes through the transversus foramen, because now I'm just trying to give you a sub-anatomy of it before I move down to talking about its physiology. So it ascends to the foramen transversarium. So the foramen transversarium is located in the transverse foramen, in the transverse process from our C4 vertebrate. You know, our C4, which is our cervical, the sixth cervical vertebrate, is present there. From your sixth cervical vertebrate, there's a transverse process there. In the transverse process, there's a hole called the foramen, which is the transversus foramen. So it ascends through that transversus foramen from C6 above to C1, from C6 to C1. So when it passes the cervical vertebrate, it enters the brain through the foramen magnum. I get him now. So it passes through the skull, through the foramen magnum, and when the vertebral artery passes to the foramen magnum, then what does it do? It unites to form what we call the basilar artery. So the vertebral artery from side to side fuses to form the basilar artery at the pontomedullary junction. So like you are seeing it now, this is the pontomedullary junction. From the pontomedullary junction, it gives two branches called the posterior cerebral artery, I get him now, and superior cerebellar artery. That's the cycle of the Willis. The termination of the vertebral artery is as a continuation of the basilar artery, and when it forms the basilar artery, it now terminates. The basilar artery terminates as the posterior cerebral artery and the superior cerebellar artery. The common carotid artery is a branch of what we call the arc of the aorta. In the arc of the aorta, what happens? It is a part that is a continuation of the ascending aorta. So the arc of the aorta, it is coming from there. We have the left common carotid artery and we have the right common carotid artery. So when it originates from there, what happens? At the upper border of the thyroid cartilage, are you getting me now? At the upper border of the thyroid cartilage, it gives what we call an external carotid and an internal carotid. So the internal carotid, what does it do? It travels through many parts. So you go watch my video on internal carotid and external carotid. So it travels through many parts and it comes and forms this cycle together with the posterior cerebral artery. Because now this part, which is the internal carotid artery, gives an anterior cerebral artery, a posterior communicating artery, and continues as the middle cerebral artery. So you can see the anterior cerebral artery, you can see the middle cerebral artery, and you can see the posterior communicating artery. That is what forms the cycle of the Willis. Are you getting now? So the cycle of the Willis is formed by the vertebral artery, which continues as the basilar artery, and the internal carotid artery, which continues as the what? Anterior cerebral artery, posterior communicating artery, and the middle cerebral artery. So this is how they supply the various parts of the brain. So go watch my video on the cycle of the Willis. I only just give you the sub-anatomy of it, how the anatomy of the cycle of the Willis is. So now, since we know that the brain is supplied through the cycle of the Willis, basically from the vertebral artery and the internal carotid artery, we should now know that the brain takes up to 20% of the oxygen for the body. 20% of the oxygen in which the body is receiving, because it is a very, very sensitive tissue. And also remember, I told you it collects up to 15 to 20% of the cardiac output. So if you go watch my video on cardiac output, I give you different distribution of the cardiac output, different distribution. The liver is taking 30%, the kidney is taking about 25%, the brain is taking about 15 to about 20%. So you go watch it. Now, if it's taking about 15 to 20%, which is, you are saying that therefore 55 to 60 ml per 100 gram of the brain tissue per minute, which means the amount of cardiac output that is receiving to about 55. So each per 100 gram of brain tissue is receiving up to 55 to 60 ml per minute. Per 100 gram of a brain tissue, a small brain tissue, is taking up to 55 to 60 ml per 100 gram. Are you getting me now? So now remember, if the brain doesn't take oxygen, it will be ischemic. If the brain tissue doesn't take oxygen, or any part of the body doesn't take oxygen, it becomes ischemic. So we have what we call cerebral ischemia. Cerebral ischemia. And when the brain is ischemic, what happens? There is a problem, because it will start losing what we call function. Some party will be having what we call focal deficit. But first of all, if the brain is ischemic for a short period of time, what happens? You start feeling dizzy. Dizziness will come, because that is the product of ischemic function of the brain. Because you start feeling syncope, you feel fainting, because your brain is not receiving oxygen. So you start feeling dizzy. And if Cushing reflex or any type of reflex do not save the brain, if the Cushing reflex or any reflex do not save the brain at that particular, because the only part that saves the brain usually is Cushing reflex, which allows the brain, cerebral vessels to supply blood. If the Cushing reflex doesn't save the brain at that particular point, you will have what we call focal neurological deficit, which means each part of the brain can be dying little by little. But if the brain doesn't see oxygen above 5 minutes, you start having what you call brain death. Brain death is when there's generalized, especially when various parts of the brain is already dead. First of all, I said there will be focal neurological deficit if there's no oxygen. Then after focal neurological deficit, what happens? It could start becoming generalized, whereby most of the brain tissues will be damaged. And if they are damaged, which means the patient will die. So how can you measure the cerebral blood flow? How can you measure it? You can measure it through what? How many methods? You can measure it through 4 methods. Number one is what? The nitric oxide method. Are you getting now? The nitric oxide method was developed by Fick. So we call it the Fick principle. The Fick principle is to indicate the nitric oxide present in the brain tissue. So if you inject, or if a patient inhale nitric oxide, what happens? You want to check the amount of nitric oxide that is present in the brain tissue. Are you getting now? Per the difference in the what? Arteriovenous blood flow. So you want to measure the amount of nitric oxide in the brain tissue and the difference in the what? atria, and the what venous system. You want to measure it. Are you getting me now? Because when you give a patient inhaled nitric oxide, it will flow in between the cerebral blood vessel 1, and also it will be taken by the brain tissue. So first of all, it enters through the arteries. When it enters through the arteries, what happens? It enters into the capillaries, enter into the brain tissue, and also pass through the vein. So you want to measure the one that the brain is collecting from the capillaries, the one in the arteries, and the one in the vein. So that's what Fick principle is talking about. So you can also do it by the next one, which is the radioactive method. In the radioactive method, you are injecting, or you are giving the patient xenon and 2-deoxyglucose. So when you are giving the patient xenon and 2-deoxyglucose, what happens? You want to know the amount of radioactive substance that will be absorbed by the brain tissue. I get it now. And the only tool you'll be using is xenon and 2-deoxyglucose. So when you use xenon and 2-deoxyglucose, it is taken by the what? Brain. Are you getting now? It's taken by the brain, and also you want to measure the one that is flowing through the vessel. So if you give it in the artery, you want to take it away from the vein, because when a patient takes it through the artery, you cannot measure it in the artery again. It enters into the capillaries, enter into the brain tissue. It is not harmful. Are you getting me now? It's not harmful. It's just the half-life is very small, so it will just go away fast. So if it enters into the brain tissue, you want to measure the difference in the brain tissue and also in the atriovenous system. So remember the two radioactive substances, xenon and 2-deoxyglucose. Are you getting now? So you want to determine the amount of this radioactive substance in different cerebral cortex, in different areas of the brain. Are you getting now? And also in the atria and the venous system. You can also use it in a CT scan too. Are you getting now? So CT scan is what we call computerized tomographic scan. It's just an advanced form of X-ray. Are you getting now? It's an advanced form of X-ray. No, naturally we have X-ray. Are you getting now? But if you want to increase the contrast or the complexity of an X-ray, and you want to run it to a 2D imaging, you use a CT scan. Are you getting now? So what are they used for now? You use a CT scan for what we call advanced or any intense pathological damage, or any active blood loss, or blood hemorrhage, or any acute condition that just occurs in the patient. So it's usually used for emergency. So when you use it now, you want to detect the localized cerebral blood flow or any brain damage. Are you getting that? Occurring at a particular time. So when there's a brain damage, or there's a cerebral hemorrhage, or the localized lesion, or metastasis spreading throughout the brain, and you want to determine it presently, you use a CT scan. The next one is an MRI, which is a magnetic resonance imaging. In a magnetic resonance imaging, what happens? This occurs by polarization of the hydrogen ion in the brain tissue. Are you getting now? So you want to know the amount of hydrogen ion that is absorbed by the brain tissue using a large magnet. So using a large magnet, you want to determine the amount of the brain tissue that absorb hydrogen ion. So when you determine the amount of brain tissue that absorb hydrogen ion, you use it to produce a resonant imaging. So now what happens? You give the patient gadolinium. So gadolinium is the contrast media used to get MRI. So when the patient absorbs gadolinium, what happens? It polarizes their brain tissue by giving them what we call hydrogen ion. So when it polarizes their brain tissue, this now creates a resonance on the machine. That's what we use to check soft tissues. We need to detect cerebral blood flow and brain lesion. Are you getting now? So but CT scan, now you are using what we call iodine contrast media. When you use iodine contrast media, but in this one you are using it to check for acute natural condition that just occur. It could be cerebral damage in any of the cerebral vessel, or it could be an acute lesion that just occur in the brain acutely. But in MRI, you are using it for a complex brain lesion, brain mass, abscess, anything that occurs in the brain. You get it now? So next one, I want to go into regulation of cerebral blood flow. We want to go into regulation of cerebral blood flow. If you want to regulate cerebral blood flow, what do? I get it. You use 3 basic methods. Number 1, you are using autoregulation. Don't forget, you are using autoregulation. You are using what we call the chemical factors, and you are using the neural factors. Autoregulation, chemical factors, and the neural factors. Autoregulation, chemical factors, and the neural factors. we'll start with what we call autoregulation. You get it now? So it's very, very important for you to know all these things. Autoregulation. So what is autoregulation here? So autoregulation is the what? Is the ability for the brain to what? Regulate its own blood flow. Autoregulation is the ability for the brain to regulate its own what? Blood flow. Are you getting me now? By its own self. So the same as the kidney, because the kidney can also do autoregulation, the brain can also do autoregulation. This is the ability for them to regulate their own cerebral blood flow. But for the brain, it is dependent on what? Effective perfusion pressure and cerebral vascular resistance. The brain is dependent on what? For the brain to carry out autoregulation, it has to be dependent on what we call effective perfusion pressure and cerebral vascular resistance. Are you getting me now? So very, very important. So to get the cerebral blood flow is usually directly proportional to autoregulation. So as far as the autoregulation is constant, the brain can circulate its own blood personally. But when you do it across a range, when it is higher than a range, it becomes a problem. Are you getting that? So what is effective perfusion pressure? Effective perfusion pressure is the balance between the MAP, which is the mean arterial blood pressure, the venous pressure, are you getting now, divided by the resistance. So the MAP, remember, if you go to my arterial blood pressure, you will see that the MAP is the diastolic blood pressure minus 1/3 of the pulse pressure. Are you getting now? So the diastolic blood pressure plus 1/3 of the pulse pressure, which means the MAP is dependent on the diastolic blood pressure. You get it now? But here you are looking at the MAP minus the venous pressure divided by the resistance. But we all know that the venous pressure is 0. You are, instead of calculating the venous pressure, you are much more calculating what we call the MAP. So the MAP is about 93 mmHg, which is between 90 to about 94, 95 mmHg. Again, the MAP is the diastolic pressure plus 1/3 of the pulse pressure, and it is heavily determined on the diastolic blood pressure. So an increase in diastolic pressure increases the MAP. Are you getting now? So here, effective perfusion pressure, perfusion is the amount of brain tissue that absorb oxygen. So you need pressure to push oxygen and blood from the blood vessel into the tissues, and it is done effectively by the mean arterial blood pressure. And the mean arterial blood pressure is determined by the diastolic blood pressure heavily. Why the pulse pressure is determined by the systolic blood pressure. Are you getting now? So you will now say that the autoregulation is dependent on the effective perfusion pressure, and the effective perfusion pressure is dependent on the MAP. Are you getting now? So the brain can regulate its own blood pressure between 60 mmHg and 140 mmHg, or 60 mmHg and 180 mmHg. Are you getting now? Don't forget. So this is very, very interesting. The effective perfusion pressure is dependent on the mean arterial blood pressure, and the mean arterial blood pressure naturally is about 193 mmHg, between 90 to about 95 mmHg. Are you getting me now? So if the effective perfusion pressure is dependent on the mean arterial blood pressure, which means the brain can auto-regulate itself between 60 to about 180 mmHg. So when it's lesser than 60 or greater than 180 mmHg, auto-regulation fails in the brain. Are you getting me? The next one is cerebral vascular resistance. Cerebral vascular resistance. So when the vascular pressure, which is when the blood vessel is reduced, or the resistance is high, or the diameter of the blood vessel is reduced more, what happens? There's a decrease in cerebral blood flow. So which means to supply blood to the brain, which means the blood vessel has to be open. There has to be vasodilation for blood to reach the brain. Are you getting me now? So when you increase cerebral vascular resistance, reducing the diameter of the blood vessel, what happens? The cerebral blood flow reduces, which means blood will not be able to go from the heart to the brain. And this occurs usually when there's an increase in what we call CSF fluid. CSF fluid is a fluid, or let me call it is an ECF fluid, or a natural fluid in the brain that helps to cushion the brain and protect it. Cerebrospinal fluid is an important fluid in the brain. Are you getting me now? So we can call it is a serous fluid, or it's an ECF fluid. ECF that is located in the ventricular system. So go to my neuroanatomy video and watch about the cerebrospinal fluid. So cerebrospinal fluid is very, very important. It is very, very important because you know what? It protects the brain. Apart from protecting the brain, it helps to nutrify brain tissues. Like, you get it now, it gives nutrient to brain tissues, it cushions the brain, it protects it, and it's what regulates pH of the brain. I get it now, it regulates the amount of stuff that's entering or going outside the brain. So it is very, very important. But it's present in the ventricles and also the central canals of the spinal cord. But in some pathological cases, especially when there's hydrocephalus, when there's increase in CSF fluid, or in a case where there is tumor occupying lesion, or in a case where there's hemorrhage or any cerebral condition that is pathological, what happens? There'll be increase in CSF fluid. And when there's increase in CSF fluid, what happens? There'll be increase in intracranial pressure. So apart from even increase in CSF fluid, apart from increase in CSF fluid, when there's any space occupying lesion, any condition, anything that causes your brain to start moving differently, any condition, I get him now, immediately there will be what we call cerebral edema. Immediately your brain tissue will start absorbing fluid. Remember edema. In edema, anytime there's any pathological condition whereby there's inflammation, vasodilatory toxins will be released, and if they are released, what happens? They will go to and vasodilate the blood vessel, especially the brain. If they vasodilate the brain, fluid from the blood will be entering into the tissues. So if fluid from the blood begins to enter into the tissues, and also there will be increase in what we call CSF fluid, immediately there will be increase in CSF fluid, and there are increase in CSF fluid, we start increasing intracranial pressure. And when it begins to increase intracranial pressure, remember the CSF fluid is surrounding the brain tissue. CSF fluid is surrounding the brain tissue in the subarachnoid space. And remember, the subarachnoid space is the space in between the arachnoid matter and the pia mater. And these are cerebral meninges that covers the brain. And take for instance now, when the CSF fluid is located in the subarachnoid space covering the brain, which means when there's increase in CSF fluid, when there's increase in CSF fluid, what happens? It will compress the brain. Are you getting me now? It will compress the brain. When it compresses the brain, it will now stop the supply of the brain with what? It will stop cerebral blood flow. Why? Because in the same subarachnoid space, there, what happens? You have what we call cerebral blood vessels there. In the subarachnoid space, you have cerebral blood vessel. Very, very well. You have the cerebral arteries and you have the cerebral veins there. So in that same space, you have also CSF fluid. So when there's increase in CSF fluid, what happens? The CSF fluid inside that space will compress the cerebral veins. When it compresses the cerebral vein, it will increase their vascular resistance. When it increases their vascular resistance, it drops their blood pressure. I get it now. When it drops their blood pressure, what happens? It will also drop their blood flow. So you get it now. Remember, in the subarachnoid space, you have cerebral blood vessels, which is cerebral arteries, cerebral veins. Are you getting it now? Also, you have CSF fluid in that area. So when there's increase in CSF fluid or during any cerebral pathological condition, what happens? It will compress cerebral blood vessel, decreasing cerebral blood pressure and decreasing cerebral blood flow. Are you getting me now? So in doing that, how do the brain now protect itself? The brain protects itself through what we call Cushing reflex. The brain protects itself through what we call Cushing reflex. Immediately, there's decrease in cerebral blood flow. Immediately, there's decrease in cerebral blood flow. There's decrease in heart rate. There's decrease in so many conditions, and there's an increase in CO2. Remember, anytime when there's a decrease in blood pressure, because that's what is happening, immediately the CSF fluid compresses the blood vessel. What happens? It has decreased the diameter. So when it decreases the diameter, what happens? There's hypotension there. There's cerebral hypotension, which means blood is not passing through the vessel because the vessel is so tiny. So if the vessel is tiny, what happens? Immediately oxygen level will drop because no blood is moving again. No blood is moving. Oxygen, the intima of the cerebral blood vessel is not receiving oxygen. The brain tissue too is not receiving oxygen. So since they are not receiving oxygen, immediately there will be accumulation of CO2 because oxygen is supposed to enter the cerebral blood vessel, and CO2 is supposed to enter into the cerebral blood vessel. Oxygen is supposed to leave the cerebral blood vessel to enter into the tissue, and the tissue is supposed to give the vessels CO2 in order for it to go back and to be respired out. So if there's no oxygen being supplied, the tissue is accumulating CO2. And the tissue is accumulating CO2. When there's increase in CO2, are you getting me now? CO2 combined with water when it combines with water, it forms carbonic acid. So when it forms carbonic acid, it divides into hydrogen ion and bicarbonate. So there will be increase in hydrogen ion. So the patient will be acidotic too. There will be acidosis. Why? Because anytime there's increase in CO2, CO2 will combine with the tissue water. When it combines with the tissue fluid, what happens? It forms carbonic acid. Carbonic acid will now form what? We split into what? Hydrogen ion and bicarbonate. So there will be increase in hydrogen ion. So there will be acidosis as far as there's increase in CO2, which is hypercapnia, due to there's no oxygen. Because oxygen in the blood, combines with hemoglobin. So when there's oxygen, oxygen enters into the tissue, and the tissue gives CO2 into the blood vessel. So now there's no oxygen, the tissue will accumulate CO2. Now, immediately this occurs, the body will simulate what we call chemoreceptor reflex. I thought you go watch my video on regulation of arterial blood pressure. Immediately there's this kind of blood composition, decrease in oxygen, which is hypoxia, increase in CO2, which is hypercapnia, and acidosis. What will happen? The body will stimulate chemoreceptor reflex, and when chemoreceptor reflex will send afferent fibers to vagus nerve and glossopharyngeal nerve to the nucleus of tractus solitarius. When it goes to the nucleus of tractus solitarius, it will not stimulate the cardio-accelerating center. What is the work of the cardio-accelerating center? Is to do what? Send sympathetic fibers, which releases epi and non-epi. Where is it going to? It's going to the heart and the blood vessel. So what do I want? I want to increase heart rate, cardiac output, and what? Stroke volume in the heart. Then I will go to that cerebral vessel and constrict it. If I constrict it, because I am constricting it to protect myself. I get it now. I'm constricting it to protect. No, now you will tell me that, but it is constricting it. Why do we have to constrict again? Because if you constrict it, it will reduce the blood flow. But now in this one is a controlled system. It is a control system, because anytime you have increase in intracranial pressure, it saves itself by helping itself to vasoconstrict, to push more blood. So now we are doing a controlled vasoconstriction. This controlled vasoconstriction is helping me push blood to the tissues, because now the blood coming, due to a decrease in the heart rate, stroke volume, and cardiac output. Now I am increasing the cardiac output. So as the cardiac output is flowing blood, I need to push the blood, because already I have hypotension already. Hypotension is caused when there's vasodilation of the blood vessel. So when there's vasodilation of the blood, I need to constrict the blood vessel to push blood. So initially there's compression of the cerebral blood vessel. There's compression of the cerebral blood vessel, and also since there's compression, there's also excessive dilation. Why is there excessive dilation? Because during inflammation, there is the vasodilatory toxins widen up the blood vessels. So now if I constrict it, what happens now? Blood will flow to the tissues. So the body protect itself, which is especially the brain, by Cushing reflex, by stimulating the vasomotor center, stimulating the cardio-accelerating center to do what? To vasoconstrict the blood vessel and restore blood flow. So don't forget, increase in intracranial pressure caused by anything compress the blood vessel. When you compress the blood vessel, now at this particular point, this increase also causes what? Cerebral vessel vasodilation, which decreases oxygen flowing to the tissues, and now there will be stimulation of decrease in oxygen, increase in CO2, and acidosis, which stimulate the vasomotor center to increase the blood pressure by vasoconstriction and to increase the heart rate, stroke volume, and cardiac output. Have you getting it now? So that's it. So that's why you have to go to my former video. Go to my former video and watch it very well. Watch it very well on the regulation of arterial blood pressure. I get him now. Morokeri doctrine on this same, because there's a scientist called Morokeri. He's a neurologist. So what did he say? He said in this principle, he said that the cerebral arteries are compressed by increasing intracranial pressure. I get it. Even though the cerebral arteries are compressed by increasing intracranial pressure or increasing CSF fluid pressure, you get it now. He said that the blood volume is not affected, even though you compress it. You are only compressing. I get it. You are only compressing the cerebral vessels. You are only compressing them, but you are not. It is not changing the volume of the brain. The volume of the brain is only constant. But one thing is that even though the volume of the brain is actually constant, but they are not receiving oxygen. They are not receiving oxygen. I get him now. But their volume are constant. But it's just that they are not receiving oxygen. Are you getting now? Because why? The brain tissues are not compressible. They are not compressible. No matter how you do, you can. It is only that they are not receiving oxygen at that particular point in time. It's just that they are not compressible too. So that is her doctrine. But the Cushing reflex were also done. It's just like they have what we call in medicine. There's a Cushing triad. The condition you see that okay, this patient needs a particular, there must be increase in intracranial pressure. Are you getting that? There must be increase in Cushing triad. There must be increase in intracranial pressure. So when there's increase in intracranial pressure, the body regulates itself by increasing what? The blood pressure, especially the systolic blood pressure. So now she said that at this particular point, when there's compression of the cerebral blood vessel, the volume of the brain remains constant because the brain is not compressible. Viscosity. I get him now. So how does viscosity increase cerebral blood flow or it decrease cerebral blood flow? Take for instance now, remember, for you to supply the brain, you have to actually vasodilate the blood vessel. I get it now. But only in some condition like increase in intracranial pressure or any pathology of the brain, anything that is damaging the brain. It could be hemorrhage, it could be brain lesion. Apart from that, where the body save itself or the brain save itself by vasoconstriction, naturally you have to vasodilate so that you can pump blood to the tissue, because the tissue does not need a compressed vessel. A compressed vessel only comes when there is an underlying condition which causes increase in intracranial pressure. So which means viscosity. When there's viscosity means that when there are more solutes in the blood. When there are more solute in the blood, what happens to the blood? The blood becomes what we call thick. The viscosity increase. Remember when I was teaching you factors affecting cardiac output and factors affecting arterial blood pressure, I mentioned viscosity. When there are more solute in the blood becomes too thick, and when the blood becomes too thick, the pressure increases, and the pressure is caused by an increase in peripheral resistance. When there are more solute in the blood, the fluid will be lesser. Why? Because the fluid will be having time to move. And remember, anytime you increase vascular resistance, you are dropping the blood flow. Are you getting me now? Anytime you increase vascular resistance, you are dropping the arterial blood, the cardiac output. Remember, cardiac output is inversely proportional to viscosity. When you increase viscosity causes increase in blood pressure but decreases cardiac output. So you need that when you are increasing the cardiac output, you have to vasodilate the blood vessel, but not too much. You have to vasodilate the blood vessel enough to supply blood to the tissues, which means when there is solute like polycythemia is like increase in red blood cell. There is thrombocytosis, increase in white blood cell. I get it. There's thrombocytosis, which is increase in platelet, and there's what leukocytosis, increase in white blood cell. Or when there's increase in proteins or increase in nutrient, anything that occurs, there could be increase in viscosity, solute in the blood. And generally, when there's high solute in the blood, there's increase in vascular resistance. Why? Because more solute, less blood flow. Then what happens? There'll be a drop in cerebral blood flow. Are you getting now? There'll be a drop in cerebral blood flow, which means cerebral blood flow is inversely proportional to what? Viscosity. Why? Because it's inversely proportional to what? Increase in vascular resistance. And remember what Mo Kelly said in our principle. He said that even though you compress the cerebral blood vessel, the volume of the brain will still remain same, because the brain is not what? Compressible. Are you getting me now? So the next one is chemical factors. In chemical factors, what happens? The brain responds to what? Are you getting me now? The brain itself, the brain and its surrounding vessel responds to particularly decrease in oxygen. I said it. That's what stimulates chemoreceptor reflex. Are you getting me now? The cerebral blood flow, the composition in the blood itself is being stimulated by what? Decrease in oxygen, hypoxia. I already explained it. Decrease in oxygen, hypoxia, increase in CO2. When you increase vascular resistance, you have dropped the oxygen supply to them. So when you drop the oxygen supply to them, immediately there will be accumulation of CO2. CO2 will be high. Join with the tissue, the fluid, the water in the tissue form carbonic acid. Carbonic acid will do what? Split it to form hydrogen ion and bicarbonate, increasing acidosis. And anytime you increase acidosis, what happens? At that particular point, you are what? Causing damage to the tissues. Because when the brain becomes acidotic, it will start accumulating fluid, causing what? Cerebral edema. Cerebral edema start causing what? Increase in intracranial pressure. And when there's a lot of increase in intracranial pressure, it can compress and cause generalized or what? Focal neurological deficit. Are you getting me now? So what happens? Immediately here, one thing you have to know, increase in CO2 causes an increase in hydrogen ion. Are you getting me? And when there's increase in CO2 hypercapnia and acidosis, what happens? This causes vasodilation of the blood vessel naturally. That is when in Cushing reflex you stimulate vasomotor center to increase vasoconstrict to increase blood flow. Only when you have increase in intracranial pressure. But naturally, when there's hypoxia, when there's hypoxia and there's increase in CO2 and there's increase in hydrogen ion, this favors increase in blood flow on a normal condition. So which means to increase blood flow, you have the CO2 level has to be high. But hey, hypoxia being the prime vasodilation of the blood vessel is also bad, because when there's prolonged hypoxia, what happens? The brain tissue starts suffering oxygen, and when they suffer oxygen, is bad. But one thing is that to save them, use Cushing reflex in so many drastic conditions. Are you getting me? But naturally, hypoxia, hypercapnia, acidosis vasodilate the blood vessel. Are you getting me? Why? Because at that particular point there's no oxygen. At that particular point there's hypotension, and when there's hypotension, immediately there will be inhibition of tonic bioreceptors, and when there's inhibition of tonic bioreceptors, the blood vessel will dilate. When the blood vessel dilates under a normal condition, blood will flow very well. But when there is an intense pathological condition, you save it by sending an information to the nucleus of tractus solitarius, stimulating vasoaccelerating center, cardioaccelerating center rather, causing increase in cardiac output, blood flow, everything, and also increase blood pressure in this sense. So the next one is the neural factors. Now in the neural factors, what happens? Now use your head. What vasodilate the blood vessel? What vasoconstrict the blood vessel? Are you getting that? If you stimulate excessive sympathetic nervous system, what will sympathetic nervous system do to you? It will do two things for you. It can vasoconstrict the blood vessel, it can vasodilate the blood vessel. Don't forget, it can vasoconstrict, it can vasodilate. It can vasoconstrict the blood vessel through alpha-1 receptor. Are you getting me now? So now epi will be released into the alpha-1 receptor. When they are released into the alpha-1 receptor, what happens? It will vasoconstrict the blood vessel, dropping cerebral blood flow. But if epi binds to alpha-2 receptor, or epinephrine binds to beta-2 receptor, either epi is binding to alpha-2 or epinephrine is binding to what? Beta-2. What is the goal of these two things? They do what? Vasodilate the blood vessel, increasing cerebral blood flow. So you can either increase cerebral blood flow by epi binding to beta-2 or by epi binding to alpha-2. But you can decrease the cerebral blood flow by increasing peripheral resistance when epi binds to alpha-1. Also, you can also regulate it by increasing what? Acetylcholine to parasympathetic nerve. So parasympathetic nerve will increase acetylcholine. Acetylcholine will bind to 8 receptor. Are you getting it now? So when it binds to a receptor, it will vasodilate the blood vessel too. So when it vasodilates the blood vessel, there will be increase in cerebral blood flow. So now cerebral blood flow can be increased to sympathetic via alpha-2 beta-2 and also parasympathetic nerve. Also, it can also be anything that vasoconstricts the blood vessel, drops the cerebral blood flow. But anything that vasodilates the blood vessel, increases the cerebral blood flow. So that is what happens at a particular point. You get it now? But if you constrict the cerebral blood vessel, you are dropping the cerebral blood flow. So also know that viscosity increase peripheral resistance, and when you increase peripheral resistance, you are also dropping the cerebral blood flow. Are you getting that? And you remember what Cushing reflex. Cushing reflex is just a protection. It's a protection when there is excessive vasocompression of the cerebral blood vessel by increasing intracranial pressure. So what is the summary now? To regulate it, what do you have to do? You have to control the diameter of the blood vessel. Are you getting now? You have to control the diameter of the blood vessel. If the diameter of the blood vessel excessively decrease, you drop the cerebral blood flow. Are you getting now? You drop the cerebral blood flow. When the cerebral blood flow cannot meet the metabolic demand of the brain tissue, there will be what? Ischemia. After ischemia, there will be focal generalized neurological deficit, and there will be death. If you don't meet the metabolic demand, and you can do it by what? Autoregulation, chemical factors, and neural factors. In chemical factors, what happens here? At this particular point, you are what? Increasing CO2 and hydrogen ion, and you're dropping oxygen. When you do this, the blood vessel will vasodilate. In autoregulation, you can only autoregulate it between what? 60 to 180. Across this point, you cannot autoregulate it again. And it's usually dependent on the map. When you increase the map, you have increased the effective cerebral perfusion pressure. Are you getting that? But in gross condition, when there is compression of the cerebral blood vessel, when there's compression of the cerebral blood vessel, what happens? The brain saves itself by Cushing reflex, by stimulating vasomotor center to increase vasoconstriction of the blood vessel to supply it. So I hope it all made sense to you and you understood everything I've said. You get it now. So you have to just look at the pictures. You have to understand what I said. You have to read it over and over again. You have to make sense from what I said, because it's quite easy. It's quite easy. Just connect. Connection is the key. Be able to know. So start from my cardiac output video and move straight. So when you read the cardiac output, you read the arterial blood pressure, it will save you here in cerebral blood flow very, very well. Okay, now so if you are new to the channel, make sure to subscribe and turn on your post notification button, so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, put it down in the comment section. I promise I'll make that video for you. I'll see you in my next video in coronary circulation. Bye bye.